Loss of appetite. Symptoms evaluation. A reduced appetite deprives an individual of essential nutrients and results in weight loss. A loss of appetite or decreased appetite is a condition where a person does not feel like eating a variety of foods. This condition is also called anorexia. Loss of appetite could accompany any illness, right from viral fever to cancers. Reduced appetite results in weight loss. It also results in lack of essential vitamins and other nutrients. The appetite usually comes back to normal once the person recovers from the illness. In some cases, the cause of reduced appetite is obvious. For example, an infection or a disease. Medication can also reduce appetite. Hence, the medications that the person takes should be reviewed. In cases where the cause is not obvious and the loss of appetite is persistent and accompanied by weight loss, a complete examination and a battery of tests may be needed to rule out any serious cause like cancer. In order to tide over the period of decreased appetite, the person is advised to eat nutritious snacks on any of their favorite food. Protein drinks help to maintain the daily nutritional intake. Adding a multivitamin may also be helpful in improving appetite and providing the daily allowance of vitamins. Patients are advised to eat less per meal and drink plenty of water. Conditions that could result in a decreased appetite include infections. Infections often reduce appetite. The infection may vary from a mild flu to a more serious infection like viral hepatitis that affects the liver, pneumonia, or tuberculosis that affects the lungs, pyelonephritis that affects the kidney, or HIV that affects multiple organs. Chronic conditions. Diseases that affect an individual over a long time can reduce appetite. These include chronic kidney disease, chronic obstructive lungs disease or COPD, and heart failure. Diseases that affect the digestive tract including Crohn's disease, irritable bowel syndrome, celiac disease, and colitis can also reduce appetite. Cancers. Cancers are often associated with severe weight loss. Cancers, especially those affecting the stomach, colon, pancreas, and ovaries, can result in decreased appetite. Treatment for cancer like chemotherapy and radiation also results in decreased appetite. First trimester of pregnancy. The first trimester of pregnancy is associated with nausea and vomiting, thus resulting in a decreased appetite. Women may actually lose some weight in the first trimester due to loss of appetite and vomiting, thus resulting in a decreased appetite. Women may actually lose some weight in the first trimester due to loss of appetite and vomiting. Mental health issues. Stress affects the appetite in both ways. It sometimes decreases appetite, whereas sometimes the person ends up eating more. Depression can also decrease appetite. Anorexia nervosa is a condition that affects some women. Women are obsessed with maintaining a very thin figure, and for this purpose, often starve themselves. Anorexia nervosa could lead to severe health problems like heart problems, thinking of bones, and damage to kidneys. Which doctor should I visit in case I have a reduced appetite? You should visit your general practitioner in case you are suffering from a reduced appetite. He may treat any obvious illness if it is mild. He may also prescribe you a multivitamin, in case he feels that there could be a serious reason for the decrease in appetite. He may refer you to a specialist.